Hepatitis is inflammation of the liver. Causative agent either viruses, bacteria, fungi, protozoa, or alcohol, drug, or poisonous chemical substance. Then hepatitis, we concentrate here on the viral hepatitis. Hepatitis symptoms: acute malaise, muscle and joint ache, fever, nausea and vomiting, loss of appetite, abdominal pain, dark urine, jaundice. Chronic type: malaise, tiredness, weakness, weight loss, peripheral edema, and ascites. By definition, we have hepatitis A and E, which are the infectious type, enterically transmitted type, والسيرم type اللي هي B والC والD اللي هي parenterally transmitted, and we have other types اللي هي F and G and others. لكن يعني الفحوصات الخاصة بها ما متوفرة عندنا Viral hepatitis overview: source with types of viral hepatitis A والB والC والD والE. Source of virus: بالنسبة للA والE هي feces, الB والC والD هي blood and blood derivative والbody fluid. Route of transmission: mode of transmission هي fecal-oral mode of transmission regarding hepatitis A and E, but hepatitis B, C, D percutaneous per mucosal transmission. chronicity: طبعا الهيباتيتس C والD والB هي راح تكون بها chronicity، لكن hepatitis A and E there is no chronicity. prevention: pre and post exposure immunization بالنسبة للA، بالB pre and post exposure immunization. الC هو ما عندنا immunization لكن blood donor screening and risk behavior modification. الD هي pre and post exposure immunization, risk behavior modification. والE there is no vaccine, so we have to ensure safe drinking water. إذن infectious agent هي all type of viral hepatitis are caused by RNA virus except hepatitis B, which is DNA. First of all, we start with hepatitis A infection. Hepatitis A is a viral liver disease that can cause mild to severe illness. Hepatitis A virus is transmitted through the ingestion of contaminated food and water or through direct contact with the infectious person. Almost everyone recovers fully from hepatitis A with lifelong immunity. يعني الإصابة بالهepatitis A تعطينا lifelong immunity و complete recovery. However, a very small proportion of people infected with hepatitis A could die from fulminant hepatitis. جزء صغير من هذول الأشخاص أو البيشنت المصابين بالهepatitis A ممكن أنه يتحولون إلى fulminant hepatitis and this would lead to death. WHO estimate that hepatitis A caused approximately in 2016 accounting for 0.5% of the mortality due to viral hepatitis. يعني hepatitis A يشكل لي الوفيات مالتها هي 0.5% من كل الديث من الفيرال hepatitis in 2016. The risk of hepatitis A infection is associated with lack of safe water supply, poor sanitation and hygiene, such as dirty hands, since it is fecal-oral mode of transmission. In countries where the risk of infection from food or water is low, there are outbreaks among men who have sex with men and the previous person who injected drug. إذن المناطق اللي عندهم يعني الريسك مال انفكشن عن طريق الفود والووتر سبلاي راح تكون له هنا راح يكثر بالأشخاص اللي هم homosexual and also those with injecting drug users. Epidemic can be prolonged and cause substantial economic loss, and a safe and effective vaccine is available to prevent hepatitis A. يعني احنا بالهepatitis A احنا عندنا vaccine that can prevent the occurrence of the safe water supply. food safety, improved sanitation, hand washing, and hepatitis A vaccine are the most effective ways to combat the disease. Person at high risk such as دول الترافلرز اللي يروحون للهاي endemic area أو men have sex with men and person who injected drugs can get vaccinated. Hepatitis A infection must be notified in writing within 5 days of diagnosis. أيضا هي من الأمراض اللي يتم الإخبار الفوري عنها. Infectious agent هي hepatitis A is the causative agent. Identification clinical feature as we said previously, acute fever, malaise, anorexia, nausea, abdominal discomfort, and this is followed a few days later by dark urine. Scope of the problem, and mortality rate is low, 0.2% of ecteric cases, and the disease ultimately resolved. Then the mortality rate of this disease is low, 0.2% of ecteric cases, and the disease ultimately resolved. Self-limited disease. Occasionally, في بعض الأحيان, extensive necrosis of the liver occurs during the first 6 up to 8 weeks of illness. In such cases في هذه الحالة راح يكون عندنا high fever, marked abdominal pain, vomiting, jaundice, hepatic encephalopathy راح يصير عندهم coma and seizure are the sign of fulminant hepatitis leading to the death in 70 to 90% of the patient. إيش وقت تحدث في هذه الحالة تكون in association with increasing with age and survival is uncommon over 50 years of age. Secondly, among patients with chronic hepatitis B or C or underlying liver disease who are super infected with hepatitis A virus, the mortality rate increases considerably. Methods of diagnosis of the disease: a blood test including IgM anti-HAV antibody confirms the diagnosis or recent infection. These antibodies are present for 2 to 4 months after infection. IgG antibody alone are evidence of past infection. يعني إذا لقيت ال IgM anti-HAV positive معناها هذا الشخص عنده recent infection اللي هي تكون هاي الانتيبودي تايتل راح تكون عالية في 2 إلى 4 months after the infection. ال IgG هي معناها يدل على إصابة سابقة. In the acute stage of illness, blood biochemistry shows elevated transaminase level indicating hepatocellular damage. أيضا راح نشوف liver enzyme راح تكون عالية مثل transaminase level indicating hepatocellular damage, and the pattern of liver function test may be non-specific in later illness. Vaccination against hepatitis A for person at risk, example travelers إلى endemic area راح يكون موجود عندنا. Period of communicability إيش قد يبقى هذا الشخص معدي. Cases are most infectious from the latter half of the incubation period, من الجزء الأخير من incubation period until a few days after the onset of jaundice. يعني هو الشخص incubation period راح يكون معدي لكن الناس ما تعرف انه هو مصاب لانه هي مثل الفلو لايك illness، لكن الاعراض اللي ذكرناها وياها هي فيبر، ماليز، نوزيا، vomiting، abdominal discomfort، بعدين يصير عندنا دارك كلر يورين، هذه كلها الأعراض من تظهر. وجوندس راح يكون نسبة الإصابة أو communicability من الجزء الأخير من second half مال incubation period إلى يعني few days after the onset of jaundice, corresponding to a peak of transaminase level in case without jaundice. Most cases are not infectious after the first week of jaundice. Long-term carriage or excretion of the virus does not occur. يعني الكرونيسيتي بهذا النوع من الهيباتيتس ما تكون موجودة. احنا قلنا الكرونيسيتي تكون بالهيباتيتس سي أكثر، هيباتيتس بي، هيباتيتس دي. Susceptibility and resistance. كل non-immune, all non-immune person are susceptible to infection. Immunity after infection is probably lifelong immunity. يعني الإصابة بالهيباتيتس A يعطي مناعة للهيباتيتس A، احتمال يعطينا lifelong immunity. The incubation period is from 15 إلى 50 days with an average of 28 إلى 30 days. Public health significance and occurrence. Hepatitis A occurs worldwide and notification have been declining nationally since the late 1990s. Infection is more common in travelers to endemic area, injecting drug users, children in childcare, and men who have sex with men. Reservoir is a human, and there is no specific treatment for hepatitis A. Recovery from symptoms following infection may be slow and may take several weeks or months. Most important is the avoidance of unnecessary medication. Acetaminophen, paracetamol, and other medication against vomiting should not be given. Hospitalization is unnecessary in the absence of acute liver failure. Since it is viral infection, there is no treatment. We should avoid unnecessary medication مثل الباراسيتامول medication اللي avoid اللي against هي vomiting and should be not given. Hospitalization ما نحتاج. We can manage the case in house and إلا إذا كان عنده هذا البيشنت acute liver failure. Therapy is aimed at maintaining comfort and adequate nutritional balance, including replacement of fluid that are lost from vomiting and diarrhea. إذن إحنا أهم جزء بالتريتمنت هي nutritional replacement ونخلي المريض دائما comfortable and adequate nutritional balance, including replacement of fluid that are lost from vomiting and diarrhea. Approximately 6 to 10% of people diagnosed with hepatitis A may experience one or more of the symptomatic relapse for up to 40 weeks after contracting this disease. يعني ممكن بعض الأشخاص تقريبا من 6 إلى 10% من الأشخاص اللي هم diagnosed with hepatitis A ممكن أنه تنعاد الأعراض عليهم راح يصير عندهم relapse بالsign and symptoms اللي هي for up to 40 weeks after contracting this disease. Control measure, preventive measure, health education about good hygiene is important, particularly hand washing before handling food and eating and after using toilet. Inadequate sanitation and housing may contribute to endemic illness. طبعا العراق هو hyper endemic with this disease. لأن نشوف هاي يعني poor hygiene متوفر عندنا. إذا لازم أسوي health education للcommunity، أزيد الوعي الصحي عن mode of transmission of this disease and how can we prevent this disease. Secondly, we have inactivated hepatitis A vaccine are available for use in person 2 years of age and over. الفاكسين مالت الهيباتيتس ما نعطيه قبل السنتين فهي من سنتين and over. Protection begins within 14 up to 21 days after the first dose. A second dose is required for long-term protection. يعني إحنا نعطي أول دوز راح يبدي البروتكشن خلال أسبوعين إلى 3 أسابيع، والسكند دوز الدوز الثانية ممكن تسوي لي long term protection. The vaccine is recommended for travelers to high risk area, person in high risk of occupation such as child care workers and emergency service personnel, injecting drug users and men who have sex with men. المن أعطي يعني أني هسه بالعراق إحنا هايبر اندميك فإحنا ما نعطي اللقاح للهيباتيتس A. ليش؟ لأنه الهيباتيتس A since it is hyper endemic and دول children اللي هم under 5 هم الأكثر فئة عمرية راح تنصاب. بعدين كل ما يكبرون راح يصير عندهم مناعة بس إذا كان ما عندنا يعني نعطي الفاكسين راح يتحول ال age distribution of this disease لل older age group وهنا الفيتاليتي ريت راح تكون أعلى. لهذا إحنا بالنسبة بالعراق ما نعطيه فقط للريسك جروب. الريسك جروب من هم اللي يعملون بالchild care workers بالemergency service personnel injecting drug users, and men who have sex with men. Control of contacts. Normal immunoglobulin 0.02 ml per kg body weight intramuscularly is recommended for household and sexual contact of the case, staff and children in close contact with a case in a child care center. Immunoglobulin is not recommended for usual office, school or factory contact. Immunoglobulin must be given within 7 to 10 days of exposure to be effective. Live vaccines such as mumps, measles, rubella should not be administered for 3 months after a dose of immunoglobulin. يعني أنا إذا أعطي الانتهاب immunoglobulin إلى patient لازم 3 أشهر وراها أنا ما يصير أعطي live virus vaccine اللي هي الممس ميزل روبيلا. And also be ineffective if given in the 14 days prior to immunoglobulin. أيضا ما أعطيها هذه اللقاحات قبل أسبوعين من إعطاء الإميونوغلوبولين. So we have to reschedule such routine vaccination. Outbreak measures. Clusters of cases possibly related to a single source will require epidemiological and environmental investigation. لهذا احنا نسوي case finding and surveillance and public health measures to prevent further cases. Use of hepatitis A vaccine in an outbreak setting is dependent on rapid identification of the outbreak and person at risk and the ability to achieve high vaccine coverage level. Hepatitis A vaccines. Techniques for growing herb in cell culture have made it possible to generate a sufficient amount of virus for vaccine production. Several inactivated or live-attenuated vaccines against hepatitis A have been developed, but only 4 inactivated hepatitis A vaccines are currently available internationally. All 4 vaccines are similar in terms of efficacy and side effect profile. The vaccine are given parenterally as a 2-dose series 6 to 18 months apart. يعني نعطي الجرعة الأولى من الفاكسين وبعدين ورا 6 أشهر أو إلى يعني سنة ونص نعطي الجرعة الثانية. No vaccine is licensed for children younger than 1 year of age. A combination vaccine containing inactivated hepatitis A and recombinant hepatitis B vaccine has been licensed since 1996 for use in children aged 1 year or older in several countries. إذن هناك combination of hepatitis A and recombinant hepatitis B vaccine هذا استحدثوه بسنة 1996 for use in children الage مالتهم هم 1 year or older in several countries. The combination of vaccine is given as a 3-dose series using 0, 1, and 6 months schedule. Hepatitis A vaccine are all highly immunogenic. Nearly 100% of adults will develop a protective level of antibody within 1 month after a single dose of vaccine. يعني ممكن إنه إحنا بسنجل دوز أو vaccine راح يعطيني protection بالadult وأيضا similar result will be obtained with children and adolescents in both developing and developed countries. Types of hepatitis A vaccine inactivated given by the intramuscular. Number of doses here 2 doses. The schedule second dose 6 إلى 18 months after the first dose. Timing varies with manufacturer. Boostering may not be necessary. Manufacturers propose at 10 years. احنا قلنا أكثر اللقاحات ممكن أسويها boostering ورا 10 سنوات. Contra indication إذا صار عندنا hypersensitivity to previous dose, adverse reaction, mild local and systemic reaction, and special precaution not protective before 1 year of age. Then we come to hepatitis E. أيضا هو hepatitis E هو mode of transmission fecal oral mode of transmission where there is no vaccine to hepatitis E as we said in the previous slides. Key facts of hepatitis E. Hepatitis E is a liver disease caused by infection with a virus known as hepatitis E virus. Every year, there are an estimated 20 million hepatitis E virus infections worldwide, leading to an estimated 3.3 million symptomatic cases of hepatitis E. WHO estimates that hepatitis E caused approximately 44,000 deaths in 2015, accounting for 3.3% of the mortality due to viral hepatitis. The virus is transmitted via fecal-oral mode of transmission, principally via contaminated water. Hepatitis E is found worldwide, but the disease is most common in East and South Asia. A vaccine to prevent hepatitis E virus infection has been developed and is licensed in China, but is not yet available elsewhere. إذن المود of transmission هو fecal-oral mode of transmission. الديزيز هو worldwide distribution، لكن هو common in East and South Asia، و there is no vaccine إلى الديزيز، لكن أكو vaccine developed in China، لكن هو not available elsewhere. Hepatitis E infection is a Group B disease, must be notified in writing within 5 days of diagnosis. School exclusion is not applicable. Infectious agent for hepatitis E virus is the causative agent. Identification clinical feature. The clinical course of the disease due to hepatitis E virus is similar to that of hepatitis A, and it is a self-limiting disease of adult age from 15 to 40 years. A high case fatality rate up to 20% has been described in pregnant women affected in the third trimester of pregnancy. هو يشبه الهيباتيتس A and it is self-limiting disease in adult and اللي هم الage group مالتهم من 15 إلى 40 سنة. high case fatality rate راح نشوفها بالحوامل during the third trimester of pregnancy about 20%. Incubation period. The incubation period varies from 2 weeks to 2 months in different epidemic, and the average incubation period has varied from 26 up to 42 days. Public health significance and occurrence. Hepatitis E infection is found worldwide. Two different patterns are observed where hepatitis E is found in. First of all, resource poor areas with frequent water contamination. Second, areas with safe water supply. The disease is not endemic in developed countries, and cases reported to date have occurred in travelers. Reservoir, human and some primate act as reservoir. Mode of transmission. Hepatitis E is transmitted via contaminated water and possibly through person-to-person transmission via the fecal-oral mode of transmission. Evidence of infection in rat and other rodents in some endemic countries suggest other mechanisms of transmission are. Period of communicability. The period of communicability is unknown. Hepatitis E virus has been detected in stool 14 days after the onset of jaundice. And susceptibility or resistance. Susceptibility is unknown, however. Disease tends to occur in adult and pregnant women are at particular risk of fulminating disease. Treatment. There is no specific treatment capable of altering the course of acute hepatitis E. إذن إحنا هو viral infection، فما عندنا treatment خاصة إنه توقف الكورس أو تعترض الكورس of the disease. As the disease is usually self-limiting, hospitalization is generally not required. إذن الhospitalization إحنا ما نخلي البيشنت يدخل المستشفى إلا في حالة إنه صار عنده fulminant hepatitis, however, and should be considered for symptomatic pregnant women. يعني إحنا في حالتين الhospitalization تكون required في حالة fulminant hepatitis في حالة pregnant women عند إصابتها بالthird trimester. Immune suppressed people with the chronic hepatitis E benefit from specific treatment using ribavirin, an antiviral drug. In some specific situation, interferon has also been used successfully. يعني إذا الأشخاص ذول الإميون سبريشن ممكن أستعمل لهم الأنتيفيرال تريتمنت اللي هي الريبافيرين، وممكن أستعمل الانترفيرون successfully in treatment of this disease. Control measure, preventive measure, since there is no vaccine till now for hepatitis E, so we concentrate on good personal hygiene is important, particularly after defecation, and travelers to endemic area should be advised of the risk of the disease and avoid ingestion of potentially contaminated water. Control of a case treatment is supportive treatment only, particularly the maintenance of hydration. Food handlers must not work for at least 7 days after the onset of jaundice and until they are well. يعني هنا ما عندنا احنا treatment خاصة للهepatitis E since it is viral infection, so supportive treatment will be used, و particularly احنا نخلي maintain الhydration of this patient. Food handlers نمنعهم من العمل for at least 1 week or 7 days after the onset of jaundice and until they are well. So it is recommended that healthcare workers and childcare workers remain away from work for at least 7 days after the onset of illness and until well. Children should not attend the school or childcare for 7 days after the onset of symptoms. Control of contact, consider the diagnosis in symptomatic contacts, immunoglobulin prepared from donors in non-endemic countries will not prevent infection or disease. If the case has worked as a food handler or child care workers or healthcare workers, surveillance for further cases in the workplace carried out. Control of the environment. Infected persons should be advised to maintain strict personal hygiene and to avoid preparing meals for others unless adequate food safety can be guaranteed. Regarding the problem in Iraq, 2005 up to 2006, hepatitis A is hyperendemic in Iraq with a prevalence rate of 96.4, and it is a disease of childhood, and after the second decade of life there is no obvious increase and it is a prevalence. Hepatitis E now it is endemic in Iraq with a prevalence rate of 20.3%. IgG antibody marker after it was previously sporadic cases and scattered cases. Male have a slightly higher prevalence rate. A steady increase in prevalence is observed with advancing age. And thank you.